Good afternoon. I'm Dr. Jazz Atwal. I'm the Deputy Chief Provincial Public Health Officer. Today we are announcing one additional death due to COVID-19 from the Winnipeg Health Region. I want to offer my condolences to the family, friends of the individual identified today. The current 5-day COVID-19 test positivity rate is 7.2% provincially and 8.2% in Winnipeg. As of 9:30 a.m. today, 295 new cases of the virus have been identified in Manitoba. And the total number of lab-confirmed cases in Manitoba is 38,729. The province is making changes to contact tracing processes for some cases of COVID-19 variants of concern. Currently, variants of concern, or VOCs, account for approximately 50% of all new COVID-19 cases, with the highest proportions being in southern Manitoba. The variant originally identified in the UK, the B117 variant, is responsible for the majority of Manitoba's VOC cases. Until now, public health officials have notified cases if their samples screen or sequence as positive for a variant of concern. This triggered a more detailed case investigation to see if cases could remember any additional information to the information they had provided before. However, public health now treats all cases as if they have a VOC, and there is no difference in the management of cases and contacts. With case counts rising and the proportion of VOC cases increasing, public health needs to focus its resources on first case investigations to get as much information as possible as soon as possible. That's why public health will no longer be specifically notifying all people if they screen positive for the B117 variant of concern. In areas of the province where the proportion of VOCs and B117 variants are low, such as northern and remote communities, this notification and check may still occur and continue for B117. Since public health already treats every positive case as if they have a VOC, there is more aggressive case and contact management overall. For example, all members of a household of a positive case already have to self-isolate when they are advised a household member has tested positive until that close contact tests negative. All household members of cases are considered close contacts, and we have already reduced the time frame for defining a close contact from 15 minutes to 10 minutes. Public health officials will continue to notify people if they test positive for the B1351 variant and the P1 variant of concern, as well as other emerging variants of concern, as they are much less common in Manitoba at this time. Cases are notified of the results and ask some additional questions to confirm the information provided in the initial interview. And the COVID-19 variant of concern dashboard will continue to report cases of the B117 variant as regional totals. Some of the VOC screening results that are consistent with B117 may be reported as unspecified VOCs, as genome sequencing will only be performed on a sample of these going forward. Our testing numbers have steadily increased over the last number of weeks. 3,526 tests were run Thursday. This will help us in our fight against COVID-19 and the variants of concern. However, public health officials are reminding Manitobans that in most cases, they should only seek testing at a provincial test site if they are symptomatic, have been identified as a close contact, or have been directed to get testing by public health. This will help ensure that those who need to be tested can continue to access testing as easily as possible. Those who go for diagnostic testing need to self-isolate, as will their household, until they get a negative test result back. Manitobans are also reminded that there are several options available to access testing, including drive-through, walk-in, or by booking an appointment by calling 1-855-268-4318 or online via the manitoba.ca website. New public health orders went into effect this week. They are a foundation for action, but public health cannot do this alone. We need Manitobans to understand that we're at a critical time and we need to do a little bit more. This means staying home as much as possible, reducing the number of contacts you have, and wearing masks when you're around others from outside our own households, even when you're outside. Businesses and organizations can play a role, and I ask leaders to help ensure people are staying apart in their facilities. Encourage your employees to stay home if they're sick and self-isolate if they are a close contact to a case. And make it easy for them to make an appointment to get their vaccine. While the vaccine is one way to reduce the spread of the virus, we are not there yet. There are still many Manitobans who have not yet received a dose of a vaccine. It's up to all of us to take steps to protect each other as best we can by following the public health orders and practicing the fundamentals. As we get more and more shipments of vaccine, we'll be better able to protect those most at risk. And once we have as many first doses done as possible, we will be opening up second doses to make sure everyone is fully vaccinated. But right now, please stay home as much as possible. Reduce your close contacts, self-isolate if you or someone else is sick, and make an appointment to get vaccinated as soon as possible. Over the course of these orders, we expect more than 300,000 vaccinations will be administered. This is very important. We want people who need to get vaccinated as soon as possible when they are eligible. Thank you, and I can now take questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Winnipeg Free Press, Katie.
Good afternoon, Dr. Atwal. I have a question about the modeling that public health has access to at this point in our third wave. When are you going to release the epidemic modeling, and what is our current trajectory over the next 14 days?
Well, so that's a great question. Obviously, we've seen our case numbers increase. We have more vaccine rolling out as well on a week-to-week basis. We have, close to 400,000 Manitobans vaccinated as well. And week by week, that number goes up. Day by day, that number goes up. From a modeling perspective, from a case number perspective, our rolling 7-day average, right now we're averaging about 239 cases on a rolling 7-day average. That's up 33% from last week. We've been having that 33% increase week by week for the past 3 weeks as well, and when you sort of smooth that out. Our hospitalization numbers have been relatively stable. They are a little bit up this week compared to previous weeks, but relatively stable to even 4 weeks ago. Our ICU numbers are up, though. They're going up about 8% per week over the last 3 to 4 weeks' time. So, modeling takes into account behaviors. There's different forms of modeling with extreme adherence to, orders and measures and limited adherence to that as well. So whatever input you put into a model, you could show a lot of different things. I think we're going to expect to see probably an increased rise in cases going forward still for a period of time. We just enacted our measures on Wednesday, so to see the results of that, what comes to fruition from those orders, will take a week to 2 weeks to really see the case number generation from that. Coupled with that, with a lot of vaccine out, we're seeing obviously less fatalities. We had our most vulnerable vaccinated early on, so we are seeing much less fatalities. We're seeing a little less hospitalization related to some of those who were vaccinated early. And obviously, we're going to continue to monitor that. So, we always review models. We review our own models. We have different forms of that, and we're going to just continue to look at that and see and inform Manitobans on a weekly basis based upon that.
Okay, thank you. I have another question about vaccines for teachers. With the supply that we have currently, why do we need to send teachers to North Dakota to get vaccines? And also, what will happen if they are across the border and they have an adverse reaction to the vaccine?
Yeah, so the work on accessing vaccine for teachers across the border is ongoing. I don't have any specific details on that. There's work being done on that right now. And I'm sure it'll happen over the next few days as well. When more information is available, we'll provide that to the public. We have a limited supply of vaccine. We are prioritizing those at greatest risk with the vaccine. Obviously, if we had vaccine for everyone, we'd be giving vaccine out to everyone. We do have to create these priority groups. Teachers right now can get vaccine if you are age eligible. If you work in certain districts as well, anyone within that district, is able to access that vaccine as long as they fit one of those priority groups as well. So it's challenging, I understand, but I mean, the access is there. And again, as more vaccine comes in, we're going to see the ability for everyone to access more vaccines as well.
From Global News, Brittany.
Hi, good afternoon, Dr. Atwal. Looking at the latest surveillance data that's available online, it says that 30.3% of cases right now have an unknown source of infection, which would suggest that a third of our cases are community transmission. What does this mean, and how can we ensure that workplaces and schools are safe and can remain open when we have such a high percentage of community transmission?
So some of those unknown acquisitions, we might have, we're asking questions related to, are you a close contact to someone? What potentially could have been your exposure? You have to remember, people have to think back 14 days as well. So it's a long time to think back what, I was doing, let's say 14 days ago or 13 days ago or 7 days ago. So there's a bit of a recall bias there where it might be hard to remember exactly what potential exposures could be there. We are looking at the number of cases that are being generated. We're trying to understand those acquisition events. There are some people too who aren't really perhaps partaking as fully as they could in an investigation. So they purposely, not provide some information as well, and that adds to that number as well. So we're really focused on trying to understand that transmission risk, where it occurs. And again, when we look at transmission and risk, we're really seeing it in those social gatherings, where we're seeing it in environments where people are getting together indoors, outside of the orders, let's say, or doing things and sharing things or having sleepovers again. Obviously when the orders changed on Wednesday, we're going to have some better data on the impact of those changes, probably by next week, and the impacts of case generation related to that. Again, we'll just have to kind of keep monitoring the situation and continue to fine tune that. And again, I think the orders will have an impact on our ability to determine acquisition events as well.
Thank you. And I know it's not perfect always to do comparisons, but when you look at those unknown source of infections back to November, when we, were going straight into that really heavy full lockdown, it was only about 25%. So we are at a higher unknown source of infection here now. We are seeing those variants of concern, and they are more transmissible. So should Manitobans be bracing for a fuller lockdown based on these numbers, or why aren't we seeing the strict measures that we saw in November?
Well, in November there, we're seeing 50% increases in cases on a weekly basis. Right now it's 33%. We have some greater restrictions put into place prior to putting restrictions in at a greater degree than we did in the fall time as well. We have vaccine rollout as well, right? So in the fall we had 0 vaccine. Now we've got close to 400,000 Manitobans vaccinated. So that has an impact on case generation. And so as we go forward, case generation is important, but also impacts on acute care system. So we know our acute care system is busy. I know they're going to get a little bit busier with COVID as well. The ICU's already gotten busier with COVID over the past 3 to 4 weeks as well. So we're continuing to monitor that situation. Anything's possible going forward. The greater Manitobans adhere to the orders and the spirit of the order and the fundamentals, the less of a chance there is for an increase in case numbers exponentially per se, causing increased acute care use. So again, this is upon all of us to limit those interactions. Whatever we're doing on an interaction basis right now, cut back a little bit. If again, a family or a friend who isn't, fully adhering to the order, the spirit of the order, nudge them, point that out to them, ask them questions about it, educate them, because this is important. The next few weeks is really, really important for us to be able to come out of this and have some, good resemblance of normalcy in May, June, at the end of May and beginning of June.
From the Brandon Sun, Colin.
Afternoon. Dr. Atwal, you and Dr. Roustan for a year now have been asking Manitobans to follow the fundamentals. And I know that's, one thing that will help reduce cases, but case numbers continue to climb right now. Why not just put stricter rules in place like in Ontario and Nova Scotia rather than leaving it to chance with the behavior of individual people?
Yeah, so the fundamentals are important. Let's not underestimate that. Let's not underestimate that most Manitobans are doing exactly what they're being asked to do. So I think we have a lot of compliance. We have a lot of adherence to that. Obviously, there are people who perhaps aren't adhering to the orders as strictly as they should be. Putting in more orders may improve that. It may not. It's all about compliance and adhering to the message. Limiting interactions by shutting everything down, sure, that does limit that ability for the virus to spread as well. But again, we talked about this before. The impacts of a lockdown have a lot of effects on individuals, on families, on people. There are negative consequences with lockdowns. It impacts one's ability to access healthcare per se, or the perception that they could access healthcare. It impacts people's mental health. It impacts their social well-being. It impacts, jobs, which again has a whole bunch of impacts on people. Shutting down schools per se, let's say that's what they've done in other jurisdictions, that has a negative impact on youth and child and development, on education. And for a lot of people, school is one of the safest and best places to be, where there is that security there. There's a lot of other measures in place to help out vulnerable populations with these environments as well that has an impact on those kids. So we have to balance that risk. Again, our case numbers are going up, and we're monitoring that. We're working with our acute care colleagues to look at the impacts on the acute care system. At this point, again, we've just put in some greater restrictions, and obviously we're not going to see the benefits of those. We don't see the benefits of a restriction in two days. It's going to take 7, 10, 14 days to really see the benefits of those restrictions on case generation. And again, we're going to have to look at case generation coupled with hospitalizations and ICUs going forward as our vaccine rolls out more and more. So we have to balance that risk of the negative impacts on not putting restrictions in and overwhelming our acute care system. So you see what's happened in Ontario. You see what's happened in other countries where the whole system's basically collapsing. Obviously, we're not going to go down that road. That's not going to happen here. But there are also negative consequences to shutting everything down on social health, on mental health. So we have to look at both sides of it and find that balance, and that's what we're striving for from a public health perspective.
Thank you. My second question is, I know at points during the pandemic, there have been data backlogs that have made it so the statistics presented maybe don't present an accurate view of how the pandemic is progressing in Manitoba. Do you know if there are any current data backlogs or data processing wait times in Manitoba?
I don't think there is. I know we had a problem earlier this week for a few hours where there was a bit of delay in accessing some information, especially from one region. I don't think there's any universal data problems that I'm aware of. If you have specific examples of it, I could look into that, obviously, but I'm not aware of anything.
From CJOB, Michelle.
Good afternoon, Dr. Atwal. So if we aren't notifying people that they have a variant of concern, what does that mean for their isolation period, as it was previously longer for variants of concern?
Yeah, the isolation period really wasn't, we first of all, we've changed our measures so that the UK variant is the dominant variant. So the measures we've changed to are more aggressive. They're going to stay consistent for any types of variant of concern cases identified in the future as well, unless something is unique about a newer type of variant of concern. So our isolation periods are the same as well. I think there was a bit of a misconception there. We did make these changes several weeks ago to be more aggressive throughout. What was different was we were going back and asking further questions of cases to see if there was something else that they could recall. So we've expanded our desires and our ability at the initial investigation to retrieve that information, to be more thorough with it at the initial interview, that we don't have to do that a second time around. So again, if you are a case, your self-isolation period is 10 days following symptom onset, as long as you're symptom-free. If you're a close contact in the same household and you can't separate out properly, then your period of isolation begins on when that case recovers, essentially. So you might be in isolation for 21 days perhaps, or 24 days perhaps. If you're a contact that's in a separate household, you have a self-isolation period of 14 days from your point of last contact with that case as well. And the rest of that household has to self-isolate as well until the contact, the original contact, gets tested and tests negative at her post-day 10.
Thank you. So, what are you seeing for variants of concern cases when it comes to the severity of symptoms, hospitalizations right now, and such?
So we have kept track of that. We know that the UK variant, which is, we're not going to distinguish that anymore here as well. The B117 variant is much more communicable. So the strain circulating in Manitoba is more communicable. We have some early data related to hospitalizations related to that. The numbers are small, but we are seeing, it seems like a greater rate of hospitalization in those in the younger populations. So in their 40s, let's say, or 30s and 20s right across the board. So in the last 14 days, I believe there was close to 20 admissions in 40-year-olds to the hospital with COVID. So that's a big number in the past 14 days. So we're going to continue to compile that information and learn from it as well. But we definitely know that the what's circulating right now is much more communicable, and that's why we've put in stricter measures. And we know it's going to have a greater impact on the acute care system from a younger population perspective because they're still not in queue to get those vaccines. They're starting to get some vaccine, but we need to get a lot more Manitobans vaccinated to limit that impact on the acute care system.
From the Winnipeg Sun, Glenn.
Yes, Dr. Atwal, Glenn Dawkins from the Winnipeg Sun. Can you clarify something for me to start with and then perhaps talk a little about it? So the change today that's being announced in the contact tracing is, can you explain the changes that have been made today? Because it sounds like, so you're not contacting people who have tested positive for the UK variant? I'm a little confused.
Yeah, so because the B117 variant is the dominant strain, greater than 50% of all cases in Manitoba are attributable to the B117 strain. It is the dominant strain now, especially in southern Manitoba, where those percentages hit probably 70% depending on your location. So there's no use in distinguishing the wild strain versus the B117 strain. It is basically our circulating strain. So in the past, what we were doing was when a B117 was identified, we called the case and advised them that they were a B117 variant and just asked a few more questions to shore up, if there was any more recall, if there was any more information that, they wanted to provide to public health in relation to exposures or contacts, et cetera. So what we've done on a public health side is we've just changed our measures around where we're going to do a much more thorough and defined investigation at the beginning so that we don't have to make that secondary call. So if you are COVID positive now, as long as you're not let's say a P1 variant or a P1351 variant, there won't be a call back to you saying that you're a variant of concern. We know the variant of concern is dominant, so we're going to just treat that as our strain in Manitoba at this point. So we'll continue to sequence, in clusters, et cetera, in relation to genetic sequencing and making sure that we're not missing out on information. But from a public's perspective, we won't be sharing information related to a specific B117 case after the initial investigation is done.
So just so I'm clear, so they will still get a contact, but they just won't get a secondary contact to say that they have the B1. It's just assumed that they are not assumed, but
yeah, that's right. So that's right. So in the past, let's say you were you're a COVID positive. An investigation was done by public health. 24 to 48 hours later, we would get information back. It was a B117 variant. We'd phone the client and say, "Hey, you're a B117 variant," and just ask a few more questions. Now there won't be that secondary phone call back.
From CBC Radio Canada, Gavin.
Hi, Dr. Atwal. Gavin from Radio-Canada here. Ontario and Quebec have announced when the general public, so all adults, will be able to book a vaccine appointment. When can we expect an announcement like this from Manitoba just to kind of put the, start of the end of this into perspective for everyone?
Yeah, so I think the vaccine dashboard has some information related to that where you can look at your queue. About a formal announcement, I'm not 100% sure. Obviously, we've had some fluctuations in the number of doses of vaccine coming in of different types of products, so that has an impact on our ability to be certain to say, by this date, everyone should be able to get a vaccine. So I think some of those numbers are being shored up at a federal level related to the Pfizer product coming in and the Moderna doses coming in, including AZ and now the Johnson product as well. That question would be best answered, I think, by the vaccine task force, as I think they have better line of sight in relation to how much vaccines coming in into the future in the next few weeks' time. And then when they're ready to provide that answer, they would provide it to Manitoba.
Well, I have you up here, so again, it's going to be another vaccine question. What's behind the change in the eligibility for the Astrazeneca vaccine that was announced today? I mean, even in Ontario, they're not using that vaccine for people under 40 years of age. Does Manitoba have some sort of uptake problem, or why was it lowered so much in this province?
Yeah, we're expanding that out. We have doses available. The vaccine's safe. So the vaccine's available for those between 30 and 39 in a priority grouping. So if you're a priority grouping in that age group, you're at higher risk of having an adverse event or having a hospitalization per se related to a COVID-19 infection. So you want to make sure that you are protected, and this is an opportunity to get yourself protected. Our distributed model, accesses a lot more Manitobans throughout the province. So this enables those in sort of more remoter areas or where it's more of a drive to come to a site to get, let's say, the Moderna or the Pfizer, or come to a pop-up site that they're able to access that vaccine through their normal care provider, which is, either a physician or a pharmacist or a nurse practitioner, let's say. So it provides more Manitobans throughout the entire province to get a vaccine that'll help protect them, protect their families, protect their community as well. So I think it's more about making it more available with the doses coming in that we have to ensure that, there is more access and it's a little bit more equitable and it's a little bit more far-reaching, with our distributive channels.
From CBC Manitoba, Bart.
Hi, Dr. Atwal. When you look at the cumulative case data at this point, people in their 20s have now had the most COVID cases so far. What is the active number for people in their 20s? Like, right now, what percentage of our active cases are people in their 20s?
Yeah, sorry, I don't have that specific number. I mean, that's something we can provide. That's something we can get, and we should be able to provide that to you after. I just don't have that number in front of me. I mean, our proxy case number is about 1,815, I believe. And you're correct. The 20 to 29 age group, 30 to 39 age group comprise most of those cases, obviously. So I just don't have those exact numbers or percentages, but that's something we can provide.
All right then. Katie asked you for the modeling. You declined. In fact, you and Dr. Roussin have, since the start of the pandemic, never provided forward-looking modeling at all. This information is presented to Cabinet. Can you please tell us how bad you expect, in a range, at least on the hospitalization and ICU numbers, things are going to get in the next couple of weeks?
Yeah, again, that's hard to provide. I mean, if there is really good adherence to restrictions and people do what they're asked and people are getting vaccinated, people are staying home when they're sick, people limit those interactions, the numbers, don't look that bad or the anticipated numbers don't look that bad. If there is complete, disregard for all of those things, then obviously the numbers look really, really bad. I think the important thing is we're keeping track of this. We're basing decisions on known facts. We're monitoring this every day. And we're going to continue to monitor it. We're not going to put Manitobans at risk. We're not going to put the acute care system at risk. We're working with the acute care system on this. We're working with all of our partners on this as well. So we're going to continue to monitor it and provide sort of information to Manitobans on a regular basis as we have been. And I mean, don't worry about a model. Let's worry about our interactions with people. Let's worry about making sure that our friends and our family and our neighbors are adhering to the orders. are adhering to the messaging. Let's make sure that when your time comes to get that vaccine, you get that vaccine. Let's make sure when you're sick, stay at home, go get tested. Let's make sure if your child is sick, to keep them home, keep your household at home until that child gets tested. Those are the important things here to curtail, to limit those issues related to COVID-19 and hospitalizations and ICUs.
From the Canadian Press, Steve.
Dr. Atwal, as you've mentioned, it takes some time for measures and new restrictions to take effect on case numbers. So I'm guessing you can surely tell us whether in the coming days, given that the new restrictions have just been imposed, are we looking at topping 500 cases a day? Are we looking at ICU numbers well above 100 like we saw in the second wave?
Yeah, I mean, I don't foresee that happening in the short term. I don't foresee that happening in the next 2 weeks. Again, that's a guess. I think when we're looking at our 7-day averages, our numbers have increased by 33% per week. So, we could add on another 33% if we didn't put in restrictions for next week as well. We put in those restrictions. We'll have to see what those numbers are. But even with that, those restrictions would have a minimal effect on the 7-day rolling average for next Friday. It'll have more of an impact for the rolling average for the Friday after that. We've been monitoring our ICUs. We've been monitoring, again, our hospitalization numbers for the whole period of the pandemic. Last 4 weeks when our case numbers were, essentially less than 100 on a rolling 7-day average to where they are right now, the hospitalization number really has remained stagnant. It went down a little bit, then it came back up. We are a little bit higher now than we were 4 weeks ago, but not on a percentage basis. It's like not even 1%, I believe, or 2%. When you look at that ICU number, though, disproportionately, that ICU number is higher. It's going up by 8% per week. So again, we're going to continue to monitor that. And you're asking me to look into a crystal ball. I don't have a crystal ball to look into. Well, we're looking at risk. We're going to look at those rolling averages. And again, we're monitoring that situation. But I don't foresee a 100% increase in ICU use in a week. That's just not going to happen. So again, we're going to continue to review this and do what's best for Manitobans.
Okay, and regarding the plan to potentially have teachers drive into North Dakota, get vaccinated, and come back, it's my understanding, and correct me if I'm wrong, teachers are not considered essential workers under the current federal exemptions for quarantining. Is that correct? And what can be done if the plan goes ahead to allow for an exemption?
Yeah, I think a lot of work that has to get done here. I think the one thing is there has to be that federal exemption for a teacher or for someone to go into the U.S. and come back in just for the vaccine, even right at the border. So there has to be some work done, and I believe that work is ongoing. And when more information is available, that will be provided to the public.
From CTV Winnipeg, Michelle.
Hi, Dr. Atwal. You have said that our ICU numbers are increasing by 8% per week. We have 39 people in ICU right now. Are you preparing at all to redeploy staff again by canceling elective surgeries or moving staff around if we needed? And what would be the patient number threshold where you would need that extra staff?
That's a great question. I'm not involved that directly on the acute care side. In the past, Chief Nursing Officer Lynette Siragusa was answering these questions, these specific detailed questions. We've met with acute care. We've met with the leads. There is work there for sure. They're busy, and we understand that. And there's work that's going to continue. There are plans in place to ensure that there is adequate staffing in acute care. Whether it's ICU or emergency or within the hospital managing COVID. I don't know the exact details of that, but that's something we could take back and have Shared Health look at providing some specific answers.
Thanks. A question about public health orders. We're not quite yet at camping season, but people might be preparing for camping. Would a campsite be considered a private residence, or is that something where you could have an outdoor gathering? Like, where does the line draw? What is a private residence and what is a public area?
Yeah, so, camping season is on the horizon. We have worked with stakeholders who represent campers and camping associations, et cetera. We know there are snowbirds who are coming back where in the summertime, let's say their camper is their summer home. I mean, that is their residence. The same rules would apply to that. If you are camping and you have a site, let's say, I mean, the resident rules should be applicable to that as well. So it would follow the same rules as a residence.
And our final reporter this afternoon, Doctor, from City News, Stephanie.
Hi, Dr. Atwal, Stephanie Lasuk from City News. I understand you don't have a crystal ball. I'm not asking you to tell us exactly what's going to happen, but you do have projections. Can you tell me if those projections, the worst and best case scenarios that you're looking at, are worse or better than the projections you had around this point back in the second wave?
Yeah, again, I think we're too focused here on projections. We're dealing with COVID. We deal with it every day. If there is good adherence, if people are doing what's asked of them to limit those interactions, I think there's an ability here to plateau the cases and lessen the impacts in the acute care system. And if people don't do that, case numbers will increase, which will have an impact on the acute care system, which means we have to put greater measures in place. Exactly how that looks now compared to before, I don't have those graphs in my head. I don't have those numbers in my head right now. I don't have it memorized. I think the important message here is, there's hope on the horizon. There's a lot of vaccine coming in. A lot of people already have had their vaccine. We're seeing case counts decrease in those that are vaccinated. We're seeing the risk of hospitalization decrease in those that are vaccinated. We just haven't had enough Manitobans vaccinated yet to really start to, not have restrictions in place per se. So the focus here should be, we're a few weeks away here from having a whole bunch of other Manitobans, hundreds of thousands of other Manitobans vaccinated. We're in a tough spot. I think everyone's somewhat frustrated. It's been a long time we've been in this pandemic. There's more light at the end of the tunnel than there was 4 months ago, 3 months ago, 2 months ago, even 2 weeks ago, because there's that many more people that have been vaccinated. So our focus should be, let's look forward. Let's see what we need to do right now for the next 4 weeks to really limit those interactions, limit those hospitalizations, get as much vaccine out there, get vaccine uptake, if you're vaccine hesitant, phone your primary care provider, phone public health, ask questions. Let's get as much vaccine out there as possible so that we could, again, look at a sense of normalcy. And I'm not saying everything's going to be perfect in June, but it's going to be a lot better if we're able to manage the next 3 to 4 weeks properly, if we're able to, again, limit those interactions, limit case generation, limit hospitalizations, and have that vaccine uptake. That should be the focus of Manitobans. A projection could show you anything. It all depends on what you're inputting into that projection. There's hundreds of variables that go in there, and does it change anything? Right? What's actually happening right now, what we understand is what's most important. And the ability to look at 4 weeks down the road and know where we're going to be at 4 weeks down the road from a vaccination standpoint is what we should be looking forward to. It's getting brighter outside. Go outdoors, enjoy the outdoors. That sunlight is that ray of hope here, right? So let's go for the next 4 weeks. Let's really keep doing what Manitobans have done well right across the board. There are some exceptions there. And that's where that nudge comes in, right? Nudge your family member, nudge your neighbor, and have them adhere. Have them adhere a little bit more, and we're going to be in a good spot. We're going to be a lot better spot a few weeks from now than we are right now.
Thanks for that. Are our testing resources starting to get stretched here?
So on the testing side, we're seeing a lot of testing done, which is reassuring, right? It means Manitobans are doing what Manitobans should be doing. They're getting sick and they're getting tested. We're asking Manitobans to limit those tests that aren't required, the asymptomatic testing unless it's directed by public health, just to make sure that we don't run into pressures on the testing side. We have our a provincial lab that does a lot of testing. We have a lot of other new tools that we're using on the testing front as well. And we also have a private lab that provides a lot of testing support to Manitoba as well. So at the present time, from my understanding, the testing side is it's being pushed. But they're still managing it, and they feel comfortable where we're at. We still have other tools on the testing side we're looking at deploying in strategic ways to ensure that Manitobans have that access to testing on with a reliable specific test as well. So again, there's been work done on testing since the beginning of the pandemic, all through the pandemic, and in the last few months we've actually operationalized some new tools on the testing side, and we're going to continue to maximize the use of those tools and maybe add in a few more as well.
Thanks, everyone. This concludes our media briefing.